Well, with summer months here, it's kind of tough to hide behind long pants. But not only can vein disease not look so great, there are some health risks.
Yeah, here to inform us a little bit more is Dr. Vinay Madan from the Vein Clinics of America. He joins us. Doctor, welcome here to CT Style.
Thanks for having me.
Absolutely. Thank you for your time today. I mean, we've been talking about this before, that it's not just an aesthetic thing. It also has other health impacts.
Definitely. So, initially it'll start off as aesthetics. Patients will come in with small spider veins that they don't like the appearance of. But eventually it can get worse, especially we were talking about having kids. If you have multiple children, you can start to develop varicose veins, which are those bigger, bulging varicose veins. Initially, that might not be too big of a problem, but then eventually you'll develop symptoms along with that if left untreated. If you're healthy and you keep exercising, you can avoid the symptoms, but over time they'll get worse.
And I don't know if we could pop that up one more time, but I mean, there's a whole plethora of different types of problems.
Yes,
Can you
so that's a great picture right there. Starting from the top left, those are the tiny spider veins that you could see. The right corner are when we start to see the bigger bulging varicose veins. Ooh. And that's the ones that you'll see, people walking around the beach or... and then as we move on, you could see the swelling in that foot picture on the middle left. And now we've progressed in the degree of varicose vein disease. Now the patient is starting to see swelling in their feet. At the end of the day, they'll wake up in the morning, they don't see much swelling, but by the end of the day, they'll start to notice more swelling. And then all the rest of the pictures are really just more marked progression of vein disease. The last picture on the bottom right is really the end of it, is when you develop a venous ulcer. That's really a breakdown of the skin. And that's a problem because these patients will probably deal with venous issues for the rest of their life, and so we want to catch these patients before they turn.
We want to avoid all this, and that's where you guys come into play. So you're able to help a lot of people with this.
Absolutely. So, we want patients to come in, before they end up, with a venous ulcer. So we want to catch them when they're becoming symptomatic. So the symptoms that patients will present with, they'll feel like a dull ache in their legs. Patients will have some heaviness, tiredness, fatigue in the legs. Some patients have cramping, daytime, nighttime cramps. A lot of patients will feel restlessness. They'll get into bed, they'll find their legs kind of kicking around until they get settled in. And then, once they start to see the swelling, that's a lot of times when the patient will come in because they're starting to see some changes at the end of the day.
Sure, and we discussed pregnancy can cause this. What other factors are there?
So, hereditary is the big one. So genetics plays a big role in this. In fact, if both your parents have varicose veins, you're almost guaranteed. It's like 89 to 96%.
That's it.
And if one of your parents, you're at 50%. So if you look at mom's legs, those are the kind of legs that...
It's a good indication. So what are some of the solutions that you guys provide, and is there any recovery time? Is there any downtime in that?
Right. So the nice thing is that everything is done as an outpatient. It's done at the clinics. You come in, usually you're there for 30 minutes to an hour, depending on what you're having done. If you're doing the cosmetics, you're just coming in, having a few little pinches, having some solution put in, polydocanol, and that will get rid of the spider veins. You're up and out right after the procedure. You can really do everything you have to do for the day. You'll wear compression stockings for the short few days, and then we'll have you exercise and walk around as well.
Seems pretty easy. Take care of these veins, right? Lots of options.
Definitely a lot of options, especially for the patients with a lot of symptoms, the large varicose veins. There's really no reason to live with varicose veins or the symptoms related to it. The procedures have gotten a lot easier. Really it just takes a few pinches, a little pressure. There's really no downtime, so if people are working, they can go straight to work afterwards or come in before and go to work afterwards.
Perfect. Make it easy then.
Yeah, great service there. You can learn more online, veinclinics.com. Doctor, we want to thank you for your time today on CT Style.
Thanks for all the info.
Thank you.
All right, stay with us. More Style coming up after the break.
Cool.